Welcome to today's video, where we'll delve into a crucial topic for maintaining your overall health, especially as you age: fatty liver disease. Many older adults are unaware of how common and potentially harmful this condition can be, as it often develops quietly without showing obvious symptoms. Fatty liver disease is a major health issue that can affect anyone, regardless of their age, but it becomes especially important to address in later years. The liver is a vital organ in the body, playing an essential role in processing nutrients, filtering toxins, and maintaining overall metabolic health. When fatty deposits accumulate in the liver, it impairs its ability to function correctly. This is what's known as fatty liver disease, or non-alcoholic fatty liver disease, NAFLD, and it's becoming increasingly prevalent, particularly among older adults. What makes fatty liver disease so concerning is that it often doesn't present obvious symptoms in its early stages. As a result, many people may have it without realizing, allowing the condition to progress undetected. Over time, untreated fatty liver can lead to more severe complications, such as inflammation of the liver, steatohepatitis, liver fibrosis, cirrhosis, and even liver failure in the worst cases. But here's the good news: early detection is key, and by understanding the subtle signs of fatty liver, you can take steps to protect your liver health before the condition worsens. That's exactly what we're here to discuss today: the 8 silent signs of fatty liver disease that you should not ignore. These signs may seem harmless at first, but recognizing them early on is a critical step in preventing further damage to your liver and preserving your overall health. In this video, we'll break down these 8 silent signs, explaining how they may manifest in your body and why they might be connected to fatty liver. Armed with this knowledge, you'll be in a better position to take action and make informed decisions about your health. Remember, it's never too late to start taking care of your liver. Before we dive into the specific signs, let's briefly touch on why fatty liver disease is more common as we age. As we grow older, our metabolism tends to slow down, and our liver may not be as efficient in processing fats and toxins as it once was. Additionally, factors such as a sedentary lifestyle, poor dietary choices, excessive alcohol consumption, and certain chronic health conditions like diabetes and obesity can increase the risk of developing fatty liver disease. But regardless of the cause, fatty liver disease is a silent condition that often doesn't cause noticeable pain or discomfort until it's too late. That's why recognizing these 8 silent signs early on can make a world of difference. By being proactive about your health, you can reduce the risks associated with fatty liver and protect your body from its long-term effects. Now let's take a closer look at these 8 signs, starting with one of the most common early symptoms: unexplained fatigue. Sign 1, unexplained fatigue. One of the most common and subtle signs of fatty liver disease is unexplained fatigue. Feeling tired or sluggish is something that many people dismiss as a natural part of aging, but when you experience chronic fatigue that doesn't seem to go away, even after a full night's rest, it might be a warning sign that something is amiss with your liver. Your liver plays a key role in energy production. It processes nutrients from the foods you eat and helps to break down and store energy. When the liver is overwhelmed with excess fat, its ability to process these nutrients effectively is compromised. As a result, your body may struggle to get the energy it needs to function, leading to feelings of fatigue, weakness, and a lack of energy, even with plenty of rest. This fatigue isn't just feeling a bit tired after a long day. This is a deeper, more persistent tiredness that can impact your ability to carry out normal daily activities. If you find yourself needing naps more often than usual, feeling drained after minimal physical exertion, or unable to shake the feeling of tiredness no matter how much sleep you get, it's important to pay attention to this sign. Chronic fatigue can affect your quality of life, making it harder to stay active and healthy. It may also be a sign that your liver is under stress, struggling to perform its functions properly. So, if you notice unexplained fatigue that lasts for weeks or even months, it's time to consider liver health as a potential factor and speak to your healthcare provider. Sign 2, unexplained weight gain. Unexplained weight gain is another common but often overlooked sign of fatty liver disease, particularly in older adults. This symptom can be especially frustrating because it often happens without any changes to diet or physical activity levels. The liver plays an essential role in regulating metabolism, breaking down fats, and balancing hormones related to hunger and satiety. When the liver is burdened with excess fat, it can disrupt these processes, leading to a slower metabolism. This means that even if you are maintaining the same diet and exercise routine, you may find yourself gaining weight, especially around the belly area. Abdominal weight gain is often linked to fatty liver disease, and this excess belly fat is not just an aesthetic concern. It can increase your risk for other health problems, including heart disease, diabetes, and high blood pressure. Fatty liver disease can lead to insulin resistance, making it harder for your body to regulate blood sugar levels effectively, and this can result in weight gain. In addition to disrupting metabolism, a fatty liver also has a reduced ability to break down fat properly, causing fat to accumulate in places like the liver and around internal organs. This buildup can contribute to abdominal obesity, which is particularly dangerous for your health. If you are noticing that your waistline is expanding despite eating well and exercising regularly, it's worth considering that fatty liver could be the underlying cause. Identifying and addressing this issue early on through a healthy diet and lifestyle changes can help reverse the damage and prevent further weight gain and associated health risks. Sign 3. Abdominal discomfort. Fatty liver disease can also cause abdominal discomfort, particularly in the upper right side of your abdomen, where the liver is located. This discomfort is often described as a dull ache or a feeling of fullness, and it can be easy to overlook as general indigestion or bloating. However, if the discomfort is persistent or recurrent, it could be a sign that your liver is struggling to process the excess fat it's accumulating. The liver, when healthy, is soft and pliable, but when it becomes enlarged or inflamed due to fatty buildup, it can press against surrounding organs and tissues, causing pain. This discomfort can be mild at first, but if left unchecked, it can worsen over time as the liver becomes more congested and inflamed. It's important to note that the liver itself doesn't have nerve endings, so the pain is actually caused by the stretching of the capsule surrounding the liver or by the inflammation of liver cells. In more advanced stages of fatty liver disease, the pain may become more intense, but it typically starts as a dull ache or a feeling of fullness after eating. If you experience consistent discomfort in the upper right side of your abdomen, or if the pain is accompanied by other symptoms like nausea or fatigue, it's a good idea to consult a healthcare professional to rule out any liver issues, including fatty liver disease. Taking action early can help prevent the liver from becoming severely damaged, and you can begin implementing lifestyle changes to help manage the condition. Sign 4. Yellowing of the skin or eyes, jaundice. One of the more serious and noticeable signs of liver damage is jaundice, which is the yellowing of the skin or the whites of the eyes. This symptom can occur when the liver becomes unable to efficiently process a substance called bilirubin, which is a byproduct of the breakdown of red blood cells. Under normal circumstances, the liver processes bilirubin and excretes it through bile. However, when the liver is overwhelmed by fat and begins to become damaged, it can't clear bilirubin from the bloodstream effectively. As a result, bilirubin builds up in the body and causes the skin and eyes to take on a yellowish tint. Jaundice is often a sign of more advanced liver damage and could indicate that fatty liver disease has progressed to steatohepatitis, inflammation of the liver, or cirrhosis. While jaundice isn't always present in the early stages of fatty liver disease, its appearance signals that the liver is struggling to perform its essential functions and immediate medical attention is required. If you notice that your skin or the whites of your eyes appear yellow, it's essential to seek medical advice promptly. This could indicate that the liver is under significant strain, and the sooner you address the issue, the better the chances for managing the condition and preventing further damage. Remember, while jaundice is a serious symptom, it typically does not appear until the liver has sustained considerable damage, so it's essential not to ignore the earlier, subtler signs of fatty liver disease. Sign 5. Swollen abdomen or legs. As fatty liver disease progresses, some individuals may experience fluid retention, leading to a swollen abdomen, also known as ascites, or swelling in the legs and ankles. This can happen when the liver is no longer functioning properly and can't produce enough of the proteins needed to maintain fluid balance in the body. The liver's inability to filter toxins and regulate fluids can cause the blood vessels to leak, leading to fluid accumulation in the abdomen and extremities. This swelling can be particularly noticeable after sitting or standing for long periods. You may also notice a feeling of fullness or bloating in your stomach, which might not go away even after eating smaller portions. Swelling in the legs or ankles is another indicator that the liver is not processing proteins as it should, leading to a drop in blood protein levels. This results in water retention in the tissues, and you may feel heaviness or discomfort in your lower limbs. If you notice persistent swelling, especially in the legs, ankles, or abdomen, it's a clear sign that the liver is having difficulty handling normal bodily functions. Early detection and intervention are crucial, so don't hesitate to reach out to your healthcare provider for further evaluation. Addressing these symptoms early can prevent the worsening of liver damage and may help you manage the condition more effectively. Sign 6. Dark urine. Another potential sign of fatty liver disease is dark-colored urine, which is often a result of excess bilirubin in the bloodstream. When the liver becomes overwhelmed and is unable to process this substance properly, bilirubin is excreted through urine instead of being eliminated via bile. The presence of bilirubin in urine causes it to appear darker than usual, sometimes resembling the color of tea or cola. Dark urine is one of the more noticeable signs that something may be wrong with your liver, especially if it occurs alongside other symptoms such as yellowing of the skin or eyes. Jaundice. This symptom can also be a sign of liver inflammation or liver damage caused by fatty liver disease, so it's important to take it seriously. If you notice that your urine has become darker over time, and especially if this coincides with other signs of liver trouble, you should seek medical advice promptly. Early intervention can help prevent further damage to the liver and improve your overall health. It's important to remember that dark urine can also be caused by other factors, such as dehydration, certain medications, or specific foods. However, if the dark urine persists and is accompanied by other signs of liver disease, it may indicate the need for more specific tests to determine liver function. Sign 7. Nausea and loss of appetite. Nausea and a loss of appetite are common symptoms that may appear when fatty liver disease has progressed. When the liver is compromised, the body's ability to digest food and process nutrients effectively is reduced. This can lead to digestive discomfort, including feelings of nausea or an inability to eat the same amounts of food as before. Many people with fatty liver disease report experiencing a general sense of discomfort after eating, along with a diminished interest in food. The liver's inability to properly break down food and absorb nutrients can result in feelings of queasiness and a loss of desire to eat. This is particularly true when the liver becomes inflamed or starts to develop scarring, which can interfere with its normal functioning. In some cases, nausea may worsen after meals, particularly after consuming greasy or high-fat foods, which put additional strain on the liver. This can lead to further loss of appetite, creating a cycle that worsens as the disease progresses. If you're noticing that you feel consistently nauseous after eating, or if you're experiencing a significant decrease in appetite without any other obvious cause, it could be a sign that your liver health is deteriorating. Seeking medical advice can help determine the cause of these symptoms and guide you on the path to better liver health. Sign 8. Confusion or mental fog. One of the more subtle and often overlooked signs of fatty liver disease is cognitive decline, which can manifest as confusion, memory problems, or a general sense of mental fog. As the liver becomes increasingly damaged, it can lead to a condition known as hepatic encephalopathy. This occurs when toxins that would normally be filtered out by the liver build up in the bloodstream and begin to affect brain function. The liver's role in detoxifying the body is vital for overall health, including brain function. When the liver is unable to filter out harmful substances like ammonia, they accumulate and can disrupt the normal functioning of the brain. This can lead to symptoms such as poor concentration, forgetfulness, confusion, and difficulty with decision-making. In more advanced stages of fatty liver disease, hepatic encephalopathy can become more severe, leading to more noticeable changes in behavior, including irritability, personality shifts, and disorientation. This is a serious sign that the liver is no longer able to effectively filter toxins, and it requires immediate medical attention. If you've noticed a gradual decline in your mental sharpness or experienced difficulty concentrating, especially alongside other signs of liver problems, it's important to seek medical evaluation. Cognitive issues linked to liver disease can often be reversed or improved with proper treatment and liver support. Now that you know the 8 silent signs of fatty liver disease, it's important to take action if you recognize any of these symptoms in yourself or a loved one. Fatty liver disease is often manageable when caught early. and lifestyle changes, such as a healthy diet and regular exercise, can make a significant difference in protecting your liver. If you're experiencing any of these signs, make sure to talk to your healthcare provider as soon as possible. Early detection and intervention can help prevent further liver damage and keep you on the path to better health. Remember, your liver is a vital organ that plays a crucial role in your overall well-being. By staying informed and making proactive choices, you can help protect your liver and live a healthier life. Thank you for watching, and take care of your health.